here living the authentic life with truly, when I read her resume and read her journey, Dr. Mila Sprouse is living the most authentic life, embracing her passions, changing the world one patient at a time, one nurse at a time. And I feel so much love. Just met you once before today, but wow. Thank you for being here.
No, thank you for having me. I'm so excited to share my story with you all.
Well, and you are such a great storyteller. So let me give you, there's so much intro, but I just try to loop people in. A recent introduction of Dr. Sprouse by a known physician sums it up. So what then do you call it when barriers or obstacles or the allegedly immovable objects are moved aside and overcome by the irresistible, unstoppable force of passion, courage, dedication, and joy? We call that Mila. Wow.
When I first heard that, oh my gosh.
I know, it makes me want to cry
right.
too.
Yes, and I actually cried when I was being introduced to a big crowd. And you know the work that you do, right? Every day, it's a standard work. But for someone to go up there on the stage and introduce you in such a humbling introduction, I was just like crying. And so it was very touching. And I reflected on that. And I said, every word I live by those words. I still have opportunities to get better, but I want everyone to really live through those words, because that means you're impacting people. And that's how I set my journey when I came here. And when I went to school, that's how I meant it to be.
And so no is not an answer for you. You find a way to be creative in the approach and the way that you look at medicine and you look at taking care of people. Give us a little bit of, you've done a lot of work with Angela Duckworth and grit and tenacity. Tell us a little bit about that journey.
So it's actually the legacy my parents provided for me and worked on that. I grew up in a third world country with a lot of challenges, but more importantly, our family. We were very poor, and my parents believed in me, and they said, you can do something. So whatever you do, we will support you, even though we don't have the money. And they actually sent me to a private school.
Wow.
And every year, a stack of promissory notes that they actually signed. I graduated with a ton of promissory notes behind my name, but they wanted to have the opportunity for me to really grow. Throughout those years, I would go to school without lunch, and I would barter my brain, if you want to say that, to provide homework to others so that they can give me lunch.
Wow.
I started as a 7-year-old selling tomatoes in the market and asking for people to buy my tomatoes that I actually bartered from the farmers, and they would buy it, and I get that also to take me to school to have lunch. So I did a lot of that. I grew up in a family where the first 5 years we were considered affluent, but things happened, and after that it went downhill for my parents, and nothing was guaranteed for us. And so my parents always say, you have to work for everything. And so you have to actually make sure you create your own destiny. And that's how I operated. Every barrier in school, in high school, in college, that's what I did. And I graduated, and then the first thing I did was took the exam, and they said it's going to be very hard. Nothing is hard as long as you work on that. And I was able to pass the test, and I made it to the United States. I always say the eagle has landed, but there's more to that, right? And then throughout the years, I look for opportunities for me to just grow. And I know that over time, I really want to make sure that I impact a lot of nurses and a lot of people, especially patients. And when I had the opportunity to apply for the job at Baylor St. Luke's Medical Center, and I came from another hospital that's a really good hospital, I said, this is a place that is pretty aligned with my values, and their mission and vision is pretty aligned with mine, and it will be impacting bigger and broader group of nurses as well as patients. I want to go for it, and I am blessed that I am in this position as the Vice President of Patient Care Services at Baylor St. Luke's, and here I am. It's a long journey, but I know I still have more to do.
Okay, there's so many incredible parts to this. The belief in education that your parents had, that they believed in you, I think that that's so empowering, and that really is translate into your belief in these nurses coming forward. I love that. A huge focus of Baylor St. Luke's is bringing in new nurses. And then once they're there, keeping that education going, because through knowledge, we can all overcome so much. And you can take away money from people. Regimes can change in countries. Politicians can change. Economies change, but knowledge never changes.
I totally agree with you. I walked in at Baylor St. Luke's with the struggles of pandemic and then post-pandemic, and the challenges in vacancy across the country were not unique on that one. And so we have to pivot every time. We have to look for things we need to do. So we brought in a ton of nurses, unprecedented nurses in critical care. I cover critical care. We have one of the largest critical care department across the country. And we also, Baylor St. Luke's takes care of the top 5% sickest patients in the country. And when you don't have the resources, nurses, to take care of those patients, it stops everything at the door. We cannot do that. And so we pivoted and said, let's bring these nurses. But more importantly, what you said is retaining them. And one of the things that I have done in past work life as well as in here is providing for them the opportunity to go to conferences.
Yes.
That is one retention piece that I so believe, because I am a product of that.
Right, and you know that it changed you, and I believe whether it's faith or whether it's just family as a community, but we knew through the pandemic that community was so important to the growth. And for these nurses to meet other people with similar struggles who, we have to realize that nurses were on the front lines. Every time there's a new challenging disease that's out, they are there to manage it, to help with it, the unknowns, not knowing if they're going to get it themselves, if they're going to bring it home to their loved ones. And then because of the shortage, the hours they worked, how taxing it was on them, but to let them connect with other people like them and then learn, that sense of community has to be so powerful.
It is. One of the conferences that I love for critical care nurses to go to is the NTI by the American Association of Critical Care Nurses. Every year, there's about almost 10 to 12,000 nurses across the country and also international. What you get to see there is actually hear stories that you're not alone.
Yes.
That burnout is across the board.
Absolutely.
And so you share stories how to overcome them.
Yes.
You're not going to be by yourself. There are others going through this. So you know what? Let's listen to how they did it, and let's take that to our community, our organization, and actually modify that and fit our organization so that we can be better. When we just sit in our organization, and this, my leaders and the nurses I talked to, and even today when we did the huddle at 6:30, and I said,
You've already been to the hospital?
Yes.
Wow.
Yes.
What are your days like? What time do you normally?
Sometimes early, because we like to do the huddles in the morning.
What's a huddle?
Getting everyone together before the start of the shift, before the group on night shift goes off. So
that's
yes, we call it a huddle.
From one leaving and the next
Correct.
one coming, that there's still connection.
Right. And it's unusual to have the vice president leading the huddle.
Yes.
But usually it's, our managers or directors. But today, there were some challenges, and I was there in one of the biggest critical care units in the country, which is our CV critical care. Mm-hmm. We do a ton of open heart surgery.
Cardiovascular CV.
Yes,
okay.
Heart and lung transplants, all the devices, pretty amazing nurses. And so we walked in there today, and we saw everyone was running, but as always, they had this smile on their face. And when we said, let's huddle, everyone got together. There's about, over 30 of them.
Wow.
And we started about always reflection, right?
Yes.
That's what we do at Baylor St. Luke's, and I love that part. And then we talk about, I always go with the pillars, the quality. What have you all done? You've done so many great things. And that's so important for them to hear because they work so hard and they want to know what they have done well. And I shared with them all the metrics that they did very well, and also opportunities for us to do better. And then recognition is part of a healthy work environment.
Yes.
They have some great staff in there that have written abstracts and submitted research, and then we look at growth opportunities, and then we go team. Today is going to be a tough day, but as long as we all are working together, we can overcome these things. And I said, you guys have my cell phone. If you need me, text me.
I think
you
that's
have
so
your director.
important with leadership, is to know that you're concerned about what they think, and they feel that their voice matters and that they can be heard. It changes a group when they feel heard.
I totally agree with that. Leadership is about listening.
Yes.
Intentional listening. And I always tell my leaders, when someone walks into your office, put your phone away and make them the most important person in that room. And I feel very strongly about that. That's actually part of my dissertation. When I finished my doctoral degree, I went through that research about what leaders should be doing. And so I try to emulate that. I'm not perfect. I always reflect on things that I could do better. I was telling...
Self-awareness is a big...
Self-awareness is huge.
Yes.
It's huge. And you have the on-stage behavior and off stage as well. It's okay to decompress behind closed doors, right?
But I think it's also really inspiring as a leader to let people know that our struggles too, and that we don't always know what the next step is, but we're trying to see a bigger vision than everybody can see from our perspective and from the information we know, and we can't show it share all of it all the time with everyone. And so it's that confidence that they have in our journey. There's a quote that I read that leaders take people where they haven't been before. And you, now more than ever, pre-COVID, it was about retaining nurses. Now it's about bringing new nurses in. So you have nurses there that have the passion but don't have the knowledge. So you have some really innovative ways that you're moving forward with that. Share with us.
Of course. So we have over 200 new nurses in critical care. That's scary for a lot of people.
Yes.
Nothing scares me.
Well, that's the other good part, right? They need to know the leader's not scared.
Right.
That you believe in them. That you know you're going to give them the tools to succeed.
And that's the thing. And there's a reality to it. You will lose some.
Yes.
And you will win a lot. And
yes.
those that you're about to lose,
yes,
pay attention to them. See if you can convert them.
Yes.
Into that side where you're
yes.
going to win them. But when someone is determined to leave,
yes.
they already made up their mind.
Yes.
And here's one of the things that I tell everyone. When they do, have a conversation with them.
Yes.
We respect your decision. We know that you did that for you and your family. We would love for you to stay here, but you are going on a new journey, and we are very happy for you in the future. Let us know. Reach out to me if you need something, if you want to come back. That's lasting impact.
Absolutely. Because some people have an impression that the grass is greener, and oftentimes when you're there in the new grass, you realize that it was only the reflection and it wasn't the reality.
That's always
right.
Yes.
And because you've learned that, because you've lived it in your life lessons, I feel like that's the other thing that makes you so exceptional, is that you came from a place of pain. You came from a place of going without. You had tremendous sacrifice, and you model that behavior for the nurses. Tell us about the mentoring programs you have there.
So with that many nurses, we actually made sure, and this is about also a huge initiative by Baylor St. Luke's and Common Spirit as a whole.
Oh, yes. Explain to people what that is.
So Baylor St. Luke's is under Common Spirit, which is actually one of the largest nonprofit enterprise in the country.
Okay.
And we have 150 hospitals across the country, and each of the regions have their division. And we are under Texas division, and then Baylor St. Luke's is the flagship of the Texas division, because we are the largest organization within the Texas enterprise. So anything that we do, we get support from the division as well as the national. So we have to leverage that as well. But within the organization, we can do a lot of things. And one of the things that's the low-hanging fruit is touch base, touch point. Have meetings with them. When we started our journey with our February 2021, I was doing lunches with our new residents, and we have this beautiful atrium at Baylor St. Luke's, and I would ask them to go get their lunch, and we sit down, and I just open it up to discussion. What have you all seen? What are the things that you've seen that are positive? What are the things that are challenging? What can we do to actually help you get there? A lot of feedback. We have learned from that first group that we said we're not going to do that anymore. And this is what I tell everyone. It's a journey. Every phase, we will make mistakes, and we will make it better for everyone, which means if this group, we made mistakes with y'all, we're sorry. We're learning from it. But what you all and us are doing is creating a better journey for the future.
Yes,
so you're
through all this.
impacting others. And so I love that journey. And then the other piece is our virtual preceptorship.
Yes, I'm so glad you're talking about this because I think it's so fascinating. And I think Grace Kelly might have to go visit outside. We have Grace Kelly that is our office dog, but now she's in her begging mode instead of in her loving mode because everybody needs love, right?
Yes.
These nurses, we do at the Vintage Contessa too.
Oh my goodness.
Do you have therapy dogs at the hospital?
You know what? We don't have an official one, but a lot of our nurses actually love therapy pets.
Yes.
And that's another thing we need to
aspect of what, but I think it's hard for healthcare because dogs aren't necessarily the cleanest.
Well, that's true, but I think there's always a way to that,
yes.
right?
Okay, good. Yes. I like that idea.
Yes. So virtual preceptorship.
Yes.
So I'm a huge believer of if there's something happening that they're looking for a group to do it, my hand always goes up. I'm going to try that. That's just me. You know, what are you going to lose? You either
You've
learn
been
from
through
it.
so much, you're not afraid of failing because you know that failure is only a step in the right direction to success.
And you wonderfully said it. I mean, eloquently. Yes, that is what it is. And when
It's
they said,
only momentary. It's like, we're going to learn from this and get to the,
yes. And so when they said, we need a place to do a proof of concept for virtual preceptorship, well, I know virtual ICU from past life. And so that preceptorship was another piece. And so when they said that, wow, what an amazing thing. I want to do it with one of the units. So what it is that you actually have what we call a Cargelity camera with audio and video, and behind that, from another state, there is an experienced nurse that's watching over what you intend it to be. In this case, it's a preceptor. Well, we are bringing a ton of nurses, new nurses, and we did not have a ton of preceptors. So a layer of someone else is there helping to educate the nurses. So an example, if the live preceptor has 2 new nurses and she or he is actually busy with one of the new nurses in another patient, the other new nurse can ping that virtual preceptor, and the virtual preceptor will come on the camera and said, may I help you? And she would say, I need help as far as having the central line changed. Can you go through this with me as far as the steps? And the virtual preceptor will go over the steps, and then both the virtual preceptor and the nurse will go with that equipment, go into the patient's room, and then the virtual preceptor will be watching the nurse. It can focus onto the central line. The patient knows about this already, so they're not surprised, and the patient is taken care of. And the new nurse actually will have satisfaction that someone else is there to help them.
Right.
What an amazing concept.
Absolutely incredible. And such a big part of the challenge I hear from nurses is that there's such long shifts. It's difficult for them to be away from their families, especially a lot of moms miss the carpool pickup or drop off or the meals. This way they could be at home with their families. They could be in different locations. So it's truly such a great opportunity.
It serves a lot of purpose, right? Helping the new graduates, and then you have a place for those who want to work remote. And the other piece is that, look at the baby boomers. We're projecting millions of them actually retiring, but yet there's a bunch of them that are amazing nurses, but cannot sustain 12 hours.
No,
we can use
it's too
them.
Taxing. Exactly.
We can use that.
So give us numbers, because the numbers were astounding to me about how much, do you know how many nurses there's a lack track of, or what the hopeful numbers are for hiring?
As far as Baylor St. Luke's or
in general?
In general, so the future of nursing 2020-2030 recommendations is that based on what it is, there's going to be a shortage of almost 500,000 plus nurses across the country. And maybe I'm overinflating that, but it's in there.
It was a significant number. It was such a shocking number that you can't even comprehend. So you think, okay, so our daughter has a lot of health challenges. Even now we go to the hospital. It took us 3.5 hours to get an IV at the hospital. I mean, it's not because nurses aren't working. Literally, there's just so many people and so few people to take care of you.
And that was
at Baylor St. Luke's. That was Texas Children's. but still, and we even go so often that we have a friends and family that helps us connect with people sooner. And it's a real issue, and you don't realize it till you're there. You don't realize how important it is when there's something you need and you can't. And you're talking about critical care.
And I'm going to tell you, and I believe, and I encourage all leaders, and I think you all know this, you hear this, you've got to think outside the box to bring nurses.
Yes.
This week, I had conversation with my leader, and I told her, we're going to pivot now. Mm-hmm. We met what we set off to bring all these new nurses. We're going to pivot to actually make the flow where we get our nurses from acute care to get into critical care.
Okay.
And the reason for that is that our vacancy is going so low that we need to bring our nurses within Baylor St. Luke's to grow. And we have done that, but we have to strengthen it. And so there's just a lot of things that we can do to actually overcome the vacancy right now. We have to get ahead. We cannot be behind. When we are looking at 8 nurses going into a nurse practitioner or a CRNA, plan ahead and start filling that position because that's very important.
What's a CRNA?
It's a certified registered nurse anesthetist.
Okay.
Yes.
And how many years of training does it take to reach that level?
So right now they are required a doctoral degree. So on top of being a critical care nurse, when you get there, I believe 2 to 3 years additional. So
overall, it's a 5-year.
It's
process.
Pretty intense because
Very intense.
It's anesthesia, and there's a lot of work that it entails. But they're taking those candidates for that CRNA school from critical care. So we actually just create an advancement for a lot of nurses, and Baylor St. Luke's is one of them. We have a ton of nurses that went to CRNA as well as being nurse practitioners. So the other piece is that when you bring in more nurses, you know you're going to open up your hospital to patients. That to me is what we call initiative that improves access to care. Because if you do not
access to care is
nurses, then you're not going to be able to do that. I'm actually happy to share that I submitted the abstract of our work to the American Nurse Credentialing Center, the Magnet. I mean, this is the Magnet Credentialing Center, and they accepted the abstract that I submitted.
Wow!
And we are doing a poster presentation there, and it's sharing our journey.
That's where real change happens, when you create something that can be replicated in other places. That's when you know that your work and your voice is heard far beyond your community.
Janae, First of all, thank you for having me in here. I love sharing our stories
Yes.
at Baylor St. Luke's, sharing it to the world and making sure people get to hear it. It's powerful. The feedback, we will take that to create more stories.
Yes.
Because when you talk about research, it doesn't stop there, right?
No, it's not just about research. It's about the employees. It's about the culture. It's about also the culture that a female is a vice president. Tell us a little bit about that journey. How has being a female affected your journey? Because you also have a family. And I think that I mean, my husband is so involved in our daughter's life, but I'm ultimately responsible for her care and her health, but then also working. Let's talk about that as a woman.
Yes, and may I say, an Asian woman.
Absolutely.
Yes.
Who has learned a language and come into a community from another community.
And that is a journey as well. I've been married 39 years with my favorite husband. I call him my favorite husband.
Rob's mine too, but there's a low bar there. We'll talk about that another time.
We have 2 children, and Benjamin and Claire, and work around my favorite husband's schedule before, because he was in broadcasting.
Oh, okay.
So we move quite a bit, and there's always a joke in there. I always tell him, oh, you married me because you know I'm a nurse, so I can always get a job wherever you want to go.
Mm-hmm. Exactly.
So, okay, this is another joke. And my comeback to him is that, do you know why I married you? And he goes, why? Well, because I want my citizenship.
Girl, I tell Rob I married him because he's a jeweler. So, we all have our fun jokes.
No, it's like, anyway, it's like, no,
I love
we're
it.
just like kidding. But you have to balance, right? Work at home. You come home and you take care of the kids.
You have to have enough left for your family. And being physically caring for people who are in need of your emotional and physical attention, I think it's a lot.
I think growing up, I was kind of used to just do it until you get to where you need to be. Mm-hmm. My husband, he has been very supportive of me. I mean, very, very supportive. Uh-huh. I also owe a lot of things as far as perspective from the American way. So I was able to understand a lot of the things that I did not know growing up. And so he really helped me navigate that. He also is a huge fan of, his life. When I do presentations, he would actually sit in the back and listen. Aww. And then after that, he would come up to me and he goes, "Are you ready for my feedback?" I said, "No." Let me eat first. Girl, not ready yet. So a lot of that. And, and he always encouraged me. He says, apply for it. You can do it. I am here for you. If there's anything you need at home or whatever, I need you to let me know and I will do it. And we went through this journey after he's retired. And he says, wherever you want to go, I'll be there with you. So I was telling, is it Danelle?
Danette, yes.
Yeah. We used to live in Humble, which is 45 minutes. Yes. And then after a month, I said, I'm not going to do this anymore. He says, do you want us to sell the house? I said, sure. We sold the house, and we got a townhome a mile from Baylor St. Luke's. But what I missed has been that 45 minutes of driving back home or going to the hospital. I usually reflect a lot of reflection of what happened during the day. What could I have done better? What could I have said better? That's always one of the things that I miss. Now I cannot finish my favorite song played on the, in the car, and I'm already at home. So when I get home, I always tell him, give me 30 minutes. I need to be by myself.
Oh, I love that. And I've dissected what I believe so much of the truths to be in living authentically. And the first part of it is reflect to discover your purpose. And I don't think that you can stay on your path for a purpose without reflection. I think it's such an important part. But once you figure it out, it makes all of the decisions in your life easier. You don't struggle with decisions as much because you're constantly reflecting and staying laser focused.
That is true. He always asks me, why do you like the word unstoppable? Because I said everything should be unstoppable.
Wow.
Yes, and my favorite song is Unstoppable.
Oh my gosh, I love it. I was going to ask that too.
Yes.
It's good. It's one of those like Rocky songs. Like you could just imagine yourself running, although I'm not a runner, but running to the shopping mall. No, I'm kidding. Okay, so you are winning. You've won incredible, so many numerous awards, but this year you're receiving the Beacon Award, one of 21 nurses around the country.
25. Yeah.
25. Wow. So tell us about that journey.
So the exemplar that was submitted by someone was about our journey in medication titration in critical care, which is a huge piece in critical care across the country, and everyone struggles on
I don't know that term.
So medication titration in critical care, you basically deal with medications and you go up and down to stabilize the patient.
Okay.
Without that, your patient is going to die because these medications are powerful medications. It increases the blood pressure. It makes the heart rate go up and all of that. So in 2017, the Joint Commission released that requirement, and we all in critical care across the country. And the reason why I say always critical care across the country, I'm very involved in associations, local, regional, and national. I always believe in that, and we all were
so you
very
can share what you have here with the smaller hospital that doesn't have the access you have.
Yes, and so when we did that, a lot of hospitals are failing on that one. We actually bottomed down at Baylor St. Luke's, but I said we can do this, and so we went through the journey. It's every week. It's pretty intense. I know my leaders were, dying, but hey, we can do this. In October,
only figuratively dying.
Yes. Yes. We have to be intentional, right? We have to know at the end of what we do, it's all about the patients. That's the core of what we do.
Absolutely.
It's patient safety and quality care. So we did that. October, we made it to 95%.
Wow.
I mean, that's a huge number.
Wow.
And we're very proud of that. And our last meeting, I asked everyone to pause. And I told everyone, with all that we do, I appreciate all the work. But here's a takeaway from this. AACN, American Association of Critical Care Nurses, worked with JCO on this. When it was released, it actually caused a lot of anxiety and burnout and distress on a lot of critical care nurses. But the biggest takeaway on this is that if we truly want to impact our nursing practice, you need to have a voice. What does that mean? About creating a voice, you need to be involved. Not only within the organization, but outside the four walls of the organization. Do not let anyone dictate your practice. If you want anyone to dictate your practice, sit back and be told. You want to make a change, you need to be involved.
Be the change.
Be the change.
Yes.
And that's I'm very passionate about that.
I love your passion. Have you heard of the term called ikigai? It's a Japanese term, and it means when you find out what the world needs, what you can be paid to do, what you love to do, and what you're good at, you reach this state of flow. And you are living this. Your passion keeps you going. Your fire burns so bright that it's contagious. You truly encompass a woman with a mission and a passion, and we're so blessed to have you.
Thank you. Thank you. I'm blessed to actually be a nurse. When I was interviewed after graduation from high school, we had to go through an intense interview with all the nuns. And they said, Mila, why do you want to be a nurse? And you need to have a perfect answer. Well, I did my research as a high school student.
Yes.
And they told me how to answer it. And I said, I want to serve humanity. And I got the thumbs up. And I got out of there smiling as like, serve humanity. But then at that moment, I said, serve humanity. Well, I think this is what we're going to do over time.
Oh my gosh.
Over time. When I hear people after the pandemic or during the pandemic, I found I reconnected with nursing. I found it to be my passion. No, nursing to me has been a calling from day one.
It's a calling.
It's a calling. And
it's your discipleship. It's what you do
and
to give back to the people you love in your community.
My favorite husband and I, we drive on the weekends. We drive on the weekends. We just start out of the garage and we say, we're going to drive left, right, north, south. We just drive. And wherever we end, that's where we're going to eat dinner. And the purpose of that is to have conversation. And if we even argue on something, we cannot jump out of the car. And we've done it so many times. It's like a nice flow. And he said, I've been around nurses, honey, but you just really look at it differently. He feels it. I feel it. And I said, I don't want to die yet. I have so much to do. And he goes, you're not going to die. I said, I feel like my time is running out. It's like, what are you talking about? I said, what if someone hits me and I get into an accident? And he goes, oh, you're so over dramatic. But anyway, but that's, we're kidding around, but that's how I feel. And I may not get everyone, but at least I know I will get someone. One person, one nurse at a time. And that nurse is going to take care of that patient. And that patient is going to benefit from it.
Well, there are so many ways for people to give to support nurses. We're doing an incredible event through St. Luke's Friends of Nursing. And if you're listening to this podcast after the event, you can also just give, because we give incredible scholarships that truly help pay for these conventions and these supports for them to learn more and to bring them forward. And I'm just so proud to be a part of the organization. The event I have to tout is on April 18th, Tuesday at Baltazar Wine Storage. It's an incredible space, and it's a very intimate group getting together to celebrate these incredible nurses in St. Luke's, and we'll send more information on our website. But thank you so much for being here. Thank you for your passion, your heart, what you give to the community. Are there any parting words that you want to share?
Yes, I do. First of all, again, thank you for having me, and thank you for listening. And you all heard Tanae. there is something happening in April, and we want you to be a part of it because these kinds of events support us nurses and actually having us grow and be better nurses to take care of our patients. So join us, and Danae is going to share all that link to you. Thank you. Thank you so much.
Okay. Guys, keep loving one another in our community, keep paying it forward, and keep living the authentic life. Thanks so much. Till next week.